Don't let Fox News scare you.
$32.6 trillion. Over 10 years, can we afford that?
After the Koch-funded Mercatus Center released a study showing that the United States would save trillions of dollars by implementing a Medicare-for-All system, Fox News immediately started running segments attacking Senator Sanders' plan.
Well, I'll give you an idea what that is, Steve. The short answer is no. We can't even, no way. And here's what it is. We'd have to double all of our income taxes that individuals and corporations pay over 10 years. Double, and we still wouldn't be able to afford it. That's how expensive $32.6 trillion is.
$32 trillion sounds pretty scary, right? But it's less than we are already projected to spend on healthcare over the next 10 years. On its current trajectory, the United States is projected to spend about $7.5 trillion annually on healthcare by 2031, according to the Koch-funded study. That number would drop to a little over $7 trillion under Medicare-for-All. Over a decade, Medicare-for-All would provide universal, affordable coverage and save the country $2.1 trillion.
We're getting rid of the copays, we're getting rid of the deductibles.
Yes, we are. And I think the American people would be pretty happy about that. In addition to 30 million Americans who are uninsured, an estimated more than 40 million Americans are underinsured, meaning they pay for health insurance but still can't afford the care they need due to high copayments and deductibles. They're basically throwing their hard-earned money away while private insurance companies profit. Under a Medicare-for-All system, your taxes may go up depending on your income bracket, but you won't have to send your money to insurance companies who are ripping us off every day and whose primary interest is making money for their shareholders. Taking the profit motive out of our healthcare system benefits everyone in our country, except greedy insurance industry executives.
This is single payer. This is what Canada has.
Yes. Canada has a single-payer system, and guess what? They have better health outcomes than we do, longer life expectancy, and they cover every man, woman, and child in their country for half of what we spend per capita on healthcare.
This is when you wait online. This is when you can't get your hip replacement. You can't get your cardiac stent done.
Our office took a trip to Canada last year, and we asked Canadian patients about wait times. Here's what they had to say.
Did you feel like you got the surgery when you needed it?
Yes.
So you feel like you got the care you needed, you got the surgery
got the care I needed.
when you needed it?
Yes.
When Canadians are seriously sick, they get the care that they need and they get it right away.
People say in the United States, oh, those Canadians, they wait a long time for health care.
No, they don't.
No.
No, they don't.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
170 million people get their insurance right now through their employer. Guess what their employer does? They take a tax deduction. They don't pay taxes on it. It's an incentive for jobs. Sure. So this thing's a job killer, because if you get rid of that 170 million coverage and there's more choice, more competition, again, no competition here, no choice. So prices will not go down, and again, there's no incentive for getting a job.
Now imagine if you didn't have to rely on your employer for health insurance. That would mean freedom. The freedom to pursue any avenue in life without having to worry about what kind of health insurance a particular job might offer you. Medicare-for-All empowers employees. And on the employer side, it's very difficult for businesses in the United States to compete with companies in other countries who don't have to worry about providing their employees with health care. But don't take that from me. Listen to this small business owner.
We've experienced $400,000, $500,000 expenses for chronic illnesses for one employee or one spouse of an employee. There really is only one way of correcting our current healthcare crisis, and that is with one Medicare-for-All, single-payer, publicly financed healthcare system.
This kind of a thing means the government is there in the doctor's office telling me what to do, rationing care for me.
This is completely absurd. We spoke to multiple Canadian doctors who said there's absolutely nothing that comes between them and their patients. Unlike private insurance companies, the government is not required to make a profit, meaning patients come first in Canada.
The public insurer is how I earn my living. It's where I submit my billings, but the government's not telling me how to practice medicine. It's not telling me what tests I can or can't order. There are no bureaucrats telling physicians, telling people like me how to practice.
Okay, well, while we hear people say, free healthcare for all, it comes with a big price there.
Good to see that, because that lets people understand how ridiculous it is.
We spend trillions of dollars on healthcare each year, and we still have 30 million people uninsured. What the Koch brother funded study found is that Medicare for All is actually the more economical option here. I thought conservatives like to save money.